Welcome to Mind Matters with Dr. Gochukwu Ojiako. In our last video, we discussed mood disorder. We focused on major depressive disorder, also called MDD. However, we did not complete our discussion on MDD in that video. So today we are going to complete that discussion. So once again, major depressive disorder is one of the most common of all psychiatric disorders. It is a complex brain-based illness with primary characteristics of persistent disturbance in mood and excessive sadness that manifests with behavioral, cognitive, affective, and somatic symptoms. Major depressive disorder is a common illness with about 5% of U.S. population 18 and older having the disorder every year. Major depressive disorder is a great source of disability, and it is also the most common of all psychiatric disorders seen in primary care settings. Unfortunately, only about 50% of people with major depressive disorder receive treatment. Major depressive disorder can occur at any age. However, the average age of onset is in the mid-20s. It is a great source of morbidity for women than any other illness. It is associated greatly with mortality. According to research, 15% of individuals with major depressive disorder will die by suicide. Also, people with major depressive disorder has 4 times increased the risk of premature death than the general population. The disease pattern varies. It can involve severe episodes separated by many years. It can also involve clusters of episodes or severe episodes with remission in symptoms. But often, chronic symptoms persist over time. Risk factors of major depressive disorder includes genetics, family history, especially of a first-degree relative, postpartum period, single marital status, having other comorbidities, being a female, and having significant environmental stressors, including major losses. Prevention of MDD involves educating people of families with increased risk for major depressive disorder about the illness, and also educating the general public about the signs and symptoms of major depressive disorder, educating them about the importance of seeking treatment, the importance of treatment in symptoms resolution or remission, and when to actually seek treatment. Assessment of MDD involves using screening tools initially, such as Patient Health Questionnaire 9, also called PHQ-9. The screening is repeated every so often during the course of treatment to assess response to treatment. History involves taking detailed history of the present illness, when it started, the symptoms that the individual have experienced, treatment, if any, if the person has received any type of treatment, including medication or therapy, you want to collect those during your history collection. Also, social history is very, very important as well. That will include the person's environment, occupation, marital status, any history or current alcohol or illicit drug use, and treatment of such illicit drug use or alcohol, if any. There's really no specific physical exam findings in MDD. So, diagnosis is usually based on the history collected and mental status exam. Often, mental status exam appearance shows that the patient may be unkempt, tired looking from maybe not sleeping well, and other symptoms of depression. There's also difficulty maintaining direct eye contact. Mood may appear sad, depressed. The person may be irritable. Often, anhedonia is often always present. So is sleep disturbance and appetite disturbance. So there is no specific labs to diagnose major depressive disorder. However, it is often very essential to other labs like complete blood count, chemistry profile, TSH, vitamin B12, vitamin D, and folate. These labs are ordered to rule out other possible causes of the symptoms that is being experienced by the individual. Also, drug screening may be indicated based on the history collected. It is also important if the patient is snoring and sleep disorder is suspected. It may be important to refer the patient to a sleep specialist to rule out sleep disorders such as sleep apnea as the cause of the symptoms. Clinical management of MDD involves medication and non-medication treatment. Of course, during the acute phase of MDD, patient safety is very, very important. And that is why in acute phase, patients are often treated in an inpatient unit where they are closely monitored for safety and then stabilized on medication alone or combination of medication therapy or whatever the patient's healthcare professional feels would be the best appropriate treatment for the patient based on the symptoms that the person is experiencing. So, medication management of MDD involves using medications from the class of antidepressants called SSRIs, selective serotonin reuptake inhibitors, such as Celexa, Prozac, and Zoloft. Also, we sometimes use medications from the class called SNRIs, such as duloxetine, which is also called Cymbalta, or venlafaxine or Effexor. We also use medications called tricyclic antidepressants, or for short, TCAs. So, of course, the person's mental health professional can really look based on symptoms to decide what medications will work best for the person. The non-pharmacological treatment involves using psychotherapy, such as CBT or other type of therapies, as the person's professional can help determine what kind of therapy would be best for the individual. Sometimes, too, medications or therapy alone or combination of both may not really help with treatment as expected or as we would like to. Other types of therapies such as ECT, electroconvulsive therapy, or TMS, transcranial magnetic stimulation, can also be used for treatment-resistant MDDs. So, once again, it is essential to really know when and how to seek treatment. I would also like to specify here that symptoms that starts within 2 months of a significant loss in a person's life and doesn't persist after 2 months may not actually be MDD, but grief arising from bereavement. So it is essential to differentiate between both bereavement and grief and MDD because can have similar symptoms. However, grief symptoms doesn't continue and they can. Of course, when that happens, it becomes complicated grief that can also be treated with medication or therapy. So in our future video, we will discuss how to assess or know when somebody is suicidal and help the person get treatment. Our email address is located in the description. So please feel free to send us your general questions. We will randomly select questions to be addressed in our future videos. So like, comment, subscribe, and share this video with your friends and your families. Thank you all for watching. I am Dr. Ogochukwu Ojiako. Thank you.